Welcome to the Northeast Kingdom Voice. I'm your host, Scott Wheeler. Today, we're recording the show via Zoom. Our guest, once again, is Dr. Les Lockridge of Newport. He's back on the show to talk about COVID-19. Welcome to the show, Dr. Lockridge.
Thanks for having me again, Scott.
Well, you were on a few weeks ago, just when this pandemic was just in its early stages. And we're now a few weeks into it. What are you seeing?
Well, it's been quite a couple of weeks. We've seen an awful lot of things change, some for the better, some just for the stranger. You'll notice that I'm wearing my awesome designer face mask today, which I want to thank Sabine Anderson, local midwife and ski patrol heroine, for making for me, and she's made them for a lot of the people here in my clinic. And I think that there's probably some similar homemade masks going around everywhere out there. I went into the market in Montgomery on Saturday. Absolutely everybody there had a mask on. And I'm talking about young and old alike, even little kids running around with masks on.
So are you seeing a lot of designer masks out there too?
Oh yeah, everybody's got to express their flair. Now, I am by myself and no potential victims around. So it's okay for me to take mine off for now.
Right. Well, you wear one all the time in the clinic now, am I correct?
Whenever there's any patients in the clinic, we have our masks on. Right. And I think that that's the general standard approach to it.
Right. And what is the actual purpose of the mask?
That's a good question. It's not real clear whether the mask is going to help you stay clear of the infection, but it is clear that the mask protects other people from you. And this really is the point to wearing it. It's an altruistic act, and it's very possibly protecting somebody that you'll never meet, somebody who's somehow attached to someone else in the same store or the same building, who's frail and who won't make it past this infection if they do get it.
Right. But when are you supposed to be wearing them? Because there seems to be a lot of misunderstanding. If you're going out for a walk out in the field and there's nobody else there, do you have to wear a mask?
That's a good question. You know, if wearing a mask then was important or even possibly effective, then we'd all have a major problem, because we'd have no chance at stopping the spread of this virus if it was going to spread in those kinds of conditions. The idea behind masking is for everyone to have their own personal mask on when they're indoors and congregating. The best examples are grocery stores, pharmaceutical stores, gas stations, the essential things that we know other people are going to be at when we get there.
Right. And there's actually a lot of, with a mask, you don't just flop it on, flop it off, and put it on whenever you want. There's certain ways of doing it and what you're supposed to do.
That's right. And every mask is a little bit different, but they have a couple of commonalities about them. One is they all have nose pieces for fitting directly over your nose. That's how you tell which side of the mask is the top. There's a small, flexible, typically metal band through the top of the mask that will conform to your nose, so you can get a good seal around it. That's where the masking kind of starts. And then from there, you just want to be sure that it's snug enough around the corners of your face, that it's going to allow air in and out, but it's not going to allow air to be directly projected from your mouth.
Okay, there's different, like there's masks, like medical masks. How long are those good for?
I don't think anybody knows that. This is something that they are looking into. Can those masks be sterilized and reused? As far as I know, there's no actual data available to us on anything like that right now. You would think that it would work. Common sense tells you that it works, but it's not entirely clear. We want to conserve masks as best as we can, but when a mask obviously is not going to do its job anymore, don't keep using it.
Now, is yours considered a mask, or because yours isn't a medical mask, does that work as good as a medical mask?
What I had on just now is simple cloth. It's not an N95 mask, and it depends on what kind of environment you're going to wear it in. This is fine for wearing out in public. N95s are more for very high risk environments.
Right. You know, the one thing that that I've seen a lot of people complaining about is rubber gloves, because it isn't the gloves themselves, it's the inability of some people to realize that when you take them off, they don't belong on the ground. So there's even a wildly popular YouTube video that a woman created, and it was a bit of, you know, I'd like to call it satire, but explaining how to take off a glove and how then to dispose of it in these receptacles called garbage cans. And it's become a YouTube sensation, but there really is, like, I go to the grocery store parking lot and you'll see several or many rubber gloves on the ground. How should you be, you know, with rubber gloves? Should you be wearing those in the store? And if so, how do you dispose of them?
Well, it always makes me sad, and I think frustrates everybody to see litter in Vermont. We're really blessed with a beautiful place to be, and we shouldn't take it so lightly and so for granted. We all ought to be a lot more careful with how we approach Vermont. Uh, uh, as far as the rubber gloves go, my goodness, that would be terrible for us to come up with a real pollution problem um, related to rubber gloves because of this entire episode. You know, a problem similar to what we had with the plastic six-pack holders, or maybe the plastic straws. That would be just a wreck for that to happen because of some sort of fascination with rubber gloves. Here's the reality behind rubber gloves. They will keep virus from getting on your hands, but that's not going to help you at all if you touch your face while you have the gloves on. And it's not going to be any better than just refraining from touching your face with bare hands and sanitizing your hands as soon as you leave any risk environment.
Right. And then the thing is, other people, like what I've read is sometimes people, it makes them a little more brazen about what they do touch because they do have those rubber gloves. But from what I understand, these things, you know, are very dirty, and people have a tendency, they use the rubber gloves, but then they go to their cell phone, thus transfers any germs onto that. And I don't know one thing that I do is after reading up over the years about how filthy cell phones are, I try to wash mine down because I understand I don't know if it's true that they're dirtier than a toilet seat.
I guess it depends on whose house you're in. But the truth is, the phones are a big issue. The phones are quite a vector. Think about how often a day we touch our phones. It may be more often than we touch our own faces. And we know for sure that the virus has a lot of surface survivability. It lasts for 2 days on stainless steel, 3 days on plastic, and can infect you after sitting there for that long. So yeah, the phones are a problem. We do need to be vigilant about our phones, and I would say that's a good example. If you're touching your phone with your rubber gloves on, that's not really better than touching your face directly with your rubber gloves on. The rubber gloves aren't going to help you in either situation. Being smart and sanitizing your hands will help you a lot more.
Right. You know what, I've always tried to keep my hands clean, but I've got to admit, is I'm probably become a little obsessive compulsive, like many other people have, and I suppose that's a good thing now. But wherever I go, I'll have something like that, usually in a smaller version. And I've had thoughts about it. Is you know. My hands, they're all getting, I have dishpan hands, but besides that, is a lot of this has pretty high strength alcohol in it. And I sure hope I don't get picked up for DWI out of absorbing so much hand sanitizer, but I've really been cleaning my hands. And that's the one thing we really can do that really helps. Isn't that true?
Yeah, that's absolutely right. But I want to clarify something. I don't think it's fair for you to blame the coronavirus for giving you OCD. The coronavirus can do a lot of things, probably not that. Anybody that's out there that knows you is they're going to understand.
Yeah. And then I'm always, we have stuff like this, bleach cleaner, and we're doing just about everything. And you know what? You know what's interesting is I've been pretty honest about this. I'm not one of the what I view as over the top. I'm pretty practical, pragmatic, or whatever. That I do everything I'm supposed to do within reason. Thus, we are having the Zoom meeting. But I would rather err on the side of safety. And I'm hoping that this is over. I personally am hoping that this is overblown, but I'm preparing. I prepare for the worst. So I don't want to be laying in a hospital bed with a tube stuck down me, as I think a ventilator is, just because I got stubborn and I thought I knew all the answers.
Well, you're right. That's what a ventilator is. Essentially, it's a tube stuck down your throat and hooked to a machine that breathes for you. It's not a pleasant experience. The people that have to be on ventilators typically have to be heavily sedated, in fact, medically induced coma to even tolerate it. So one big point, try to get medical attention before it gets to that. I suppose you could argue about whether or not there's a therapy for coronavirus, but this much we do know. A lot of the people that end up on the ventilator, it's because the coronavirus has deteriorated their marginal compensation for underlying lung problems or heart problems. And those underlying lung problems and heart problems can be dealt with, and they can be dealt with a lot more effectively if we get on them earlier and try to keep you from having to get onto a ventilator. To your other point, I think your approach is correct. Okay, we want to do our due diligence on this. We really want to do everything that we can. Is it overblown? I hope so. I really hope so. But we have immediate examples of what happens in countries where they don't go at this quite so aggressively, and the results are quite disastrous. So please live your lives as best you can. Be mindful, be practical. You can do an awful lot without an awful lot of effort and an awful lot of inconvenience.
Right. And you, as you're aware, the leader of England currently is battling the COVID-19 in the hospital.
Yeah, I have differing reports as to whether he's ended up on the ventilator, but apparently this morning he is not on a ventilator. I can't tell from the different reports whether he ever got intubated. But if he did, I assure you, he was into a medical coma and could not have been running the country.
So, in other words, this virus takes no hostages. It doesn't care what socioeconomic class you are from.
No, it doesn't discriminate in that way at all. It's probably worse on certain demographics in our population, but they're not catching it more. It's just hitting them harder.
Being a champion of the underdog, or the people that maybe societies use as the underdog, I have a special place for the store workers of the time, because we talk about frontline people. You know, they're right on the front lines. No disrespect to the medical people, because I wouldn't want to be in your shoes. I wouldn't want to be in any medical person's shoes. But boy, those store workers, they're right out there making sure we're fed. But they're also putting themselves at risk for minimal pay. How should they be caring for themselves?
Yeah, I'm there with you. I've got a lot of sympathy for them. Every cashier that I see how much money they handle, and I think about the potential of money as a vector for this virus. They touch absolutely everything that you're going to buy, and so they are putting their hands on something that at least you put your hands on. And boy, I don't know about where everybody else shops, but 6 feet seems like an awful lot of space between me and any cashier that I've seen for a while. Um, and what's more, people in the medical profession, we kind of signed up for this. We knew that these kinds of things happen and that we were potentially going to face something like this in our careers. And we went forward with it, full disclosure in place. But you're right, the clerks that everybody encounters on a daily basis, they didn't really sign up for this, and they're kind of thrust into the middle.
I've always been I think a cashier's dream person, as in I've really been nice to them over the years, but I think I've gone the extra mile, and I think a lot of other people are now, because that is their profession, and it's not a profession that they should have to die for either. And I've thought that it would be really nice to lead a parade for them as well. And besides that, I think we've gotten too carried away about what is an essential worker, what is an unessential worker, because as human beings, we are all essential to somebody. And so I think I try not to divide people into different classes, because, you're essential, I'm essential, and, the homeless people, they're essential to somebody.
Yeah, those designations have come under an awful lot of scrutiny, and I think some of them looked at kind of askance as a little bit of strange.
Right.
Liquor stores, for instance, are considered essential businesses, and that's out of sheer practicality. Yeah, you can kind of grind your teeth at that and say, how is this essential? But if you close down all the liquor stores, the epidemic of alcohol withdrawal that will take over the entire country, it will make COVID look really minuscule. So a lot of these things are designated strictly on practical purposes, and it has nothing to do with the nobility of the practice within the walls.
Absolutely. So we only have a few more minutes left. How are things shaping up?
Well, I'm glad you asked. Uh, there's a couple of different points to that question. How are things going globally? How are things going nationally? And how are things locally? Uh, as far as locally, and I mean hyper local, micro local, in Orleans County, as of yesterday, we still only had 8 documented cases.
Mhm.
Now, I firmly believe that that number represents more cases than just 8. But it's better that we're not seeing an overwhelming surge in cases and undercounting them. It's better to undercount them and not see an overwhelming surge. Um, Moreover, just by experience, we haven't seen any COVID positives here. I've been liberal about my testing and I've not come up with a positive yet. I don't have anybody out there right now on quarantine that I'm highly suspicious of. And nobody here knows anyone really that's tested positive. I believe you don't either. And I think that those are excellent indicators that as of right now in Orleans County, we are still in the containment phase. It's not mitigation. It does not appear to be community spreading right now. So what does that mean for us? Well, we're still in the phase that the whole country was 3 weeks ago, where we're trying to contain the virus, contain the cases so that it's not an outbreak. The rest of the country really is in outbreak phase. They're in mitigation phase to try to reduce the impact of the outbreak. We're still trying to keep an outbreak from happening. And the practical difference is if you get sick, you really want to talk to your doctor. All right. Whether you need any specific treatment will be between you and your doctor, but your doctor is going to have some very important things to say to you in terms of how to keep from spreading whatever you have to somebody else. And they're going to want to know about your other contacts. And they're going to give you some very good information on how to advise those contacts so that we can stay in containment phase. Please
Well, I
don't
have
sit
to
home
mention
and
this.
suffer in silence.
I have to mention this, and is because I kind of know about what you're doing. Is you're not you're trying to limit the number of people visiting your patients, so you're using telemedicine.
That's right. We've got a lot of different layers of screening and prevention going on. First of all, when we're on the phone with people setting up appointments, we're screening them then. We're asking then if they have any symptoms. And again, when they get to the office, there's a sign on the door that states travel history and symptoms that you need to inform us of before you even come in the building. And once they're in the building, they're asked again at the front desk. And we're going to hopefully start doing some temperature screening soon. Everybody's wearing masks. We're disinfecting every room after live bodies are in it. We're keeping the congregation of people in the waiting room down by asking everyone not to show up until 5 minutes before their appointment or less, and not to bring anybody with them. And you will be encountered by a provider wearing a mask and sanitizing everything. So before we would even get to an encounter like telemedicine, there's so many layers of screening and cleaning beforehand. And if we can convert anybody to telemedicine, we're really going to try to do that. There are some things that you have to be in person to see the doctor and address, but anything else we're really going to try to do remote.
So with telemedicine, is it just like we're doing with Zoom, where you can see the patient and the patient can see you?
It's just like that, yeah.
Right.
We do it with DoxyMe, which is a HIPAA protected system. So it works a little better for that purpose, but it honestly looks exactly like what you and I are doing right now.
Hmm. So what are your final words on this pandemic, and if you were to have a crystal ball there, what are you looking forward to for the next few weeks?
Well, the CDC has the state projected to peak actually this week or this weekend. I think that might be a little bit on the optimistic side. Um, as I said, I think that there are more cases out there than what we know of now. However, you look at the last 2 weeks of incidents in the state, and every single day for the last 2 weeks, we've had between 20 and 40 new cases, with the exception of one day when we only had 15. And then the last couple of days have been also a little bit of a departure from that. 3 days ago, we had 70 new cases. 2 days ago, 52 new cases. But then yesterday, back to 31. So does that represent our state's peak that the CDC is talking about? Yes, potentially. I'll tell you what my personal expectation is for the state. Um, I think that their estimate is a little bit optimistic. I think that by the end of the month, we will have been through the worst of it and things will start getting back to normal. And if that's true, at this kind of pace, we will have done pretty well as a state. We only have 23 deaths so far. That's way down on the list, way down in comparison to just about everywhere else. The CDC is this morning officially saying that they think their models were a little bit too pronounced, and they think that the outcomes are going to be a little bit better than what they predicted for the country. I hope that that's true. There are some signs now that that might be true.
So your final words.
Well, everybody, this is a good time for us to be thinking about each other.
Right.
This is a good time to take your neighbor under consideration, because most of the things that we're doing are really to help other people. Let's not panic. For the vast majority of everybody, this is going to be a 3 to 7 day bug if they get it. But please be careful. There are people for whom this will be much worse. And I agree, this is an excellent time to go outside, get some exercise, get some fresh air, see some of our beautiful sights, but keep your social distancing. Don't touch things, wash your hands, and don't touch your face.
And as you know, my other life as the publisher of Vermont's Northland Journal, I deal a lot with older people. And I don't go to their homes anymore. And of course, I'm not allowed in nursing homes right now. But I'm going to tell you, just a simple phone call to some older person in your life who is sheltered in place, as they call it, they act like they've won the lottery, because a lot of older people are taking this very seriously because it's their life. But I will tell you, a lot of these older people are very social people, and they've been locked away. Just give them a call, because they are so appreciative. One day, my wife and I were out for a walk, and this couple came out of their house because they just wanted to say hello to us because they'd been holed away for so long. Just that one little thing really makes a difference in their lives.
Oh yeah, Scott, that's why I keep calling you.
Yeah, I'm a senior. Yeah, I am a senior compared to you. I do have friends who are in their 70s, but they think they're in their 60s, and I do call them periodically just to remind them that I am watching over my elderly friends, and they get a laugh out of that.
I think everybody out there should do that, and I know that the recipients of the calls will be happy about it.
Okay, well, thank you for coming on, and I'm sure you'll be back on updating us. Hopefully, the next time in 2 or 3 weeks, maybe you can update us that this is slowly becoming a thing of the past.
That would be great. Thanks for having me
Okay,
on.
and thank you for coming on, and thank you for updating us.
My pleasure. Take care.
Thank you to the viewers for tuning in to another segment of the Northeast Kingdom Voice.